Sophie Cunningham suffered a right knee injury on this play, and despite the potential severity of the injury, a big conversation point around this is that the WNBA is not doing enough to protect the safety of their players. Welcome back, everybody. I'm Dr. Brian Sutterer, and the goal in this channel is to teach you all more about the medical side of the sports world. And I've got a lot of requests to talk about the WNBA, and so I thought this injury today with Sophie Cunningham was a good opportunity to do so. We'll first start with just what I think looking at the injury mechanism in terms of potential severity, and then touch on whether or not I think this really should be a concern about the intentionality of this play. So first thing first, of course, we're dealing with a right knee injury for Cunningham, and this is going to be contact. Of course, the player for Connecticut is going to fall into the outside of her right knee, and what that's most likely going to do, we can't exactly see her foot position down here, but I think what this is causing is a forced valgus load from the outside of Cunningham's knee, pushing it inward. If we back this up a little bit, initially you can see how her right foot is pointed forward, and so any sort of impact is going to cause a hyperextension, pushing the knee backwards. But then as the play continues here, it looks like she initially picks up that right foot. We can see it start to move a little bit. That's going to start to rotate her body so that now when the Connecticut player comes in and lands on her, the force is coming in from the outside of the knee and pushing it inward. What this is going to do is potentially cause a number of injuries to the inner medial side of Cunningham's knee from this forced external valgus load pushing the knee inward. Now, the primary things that are going to be on my differential here, of course, this can cause something like an ACL tear. We can see a forced valgus load where a player falls into the outside of their knee, pushes it inward, can cause enough stress to tear the ACL. I'll admit, just the impact, the positioning of her leg, to me did not look quite as significant for something like this. I think there's a little bit more force coming in kind of from the backside, pushing the back of the knee in that direction rather than directly in from the side. And so while yes, something like an ACL is a concern when you have one of these forced load valgus type of positions where the knee is going to be pushed inwards, this can cause an ACL tear. I don't think that would be the highest on my list. Another thing to consider is, of course, if the knee buckles inward, you're going to have stretch on the inside portion of the joint. The MCL ligament sits on the inside of the joint, and so that can certainly cause some stretch in the MCL when the knee is pushed inward. And so an MCL injury would be another thing on the differential here. A third one that we don't consider too often is going to be a patella dislocation or a kneecap dislocation. Similar mechanism, whenever the knee is valgusly forced inward, the patella has a tendency in its groove to, obviously it wants to stay nice and neutral in its groove, but when patella dislocations, kneecap dislocations happen, it's usually because the patella comes to the outside, the lateral side of the trochlea, from a combination of the knee being pushed inward. And that's another thing, especially with the way that Cunningham reacts with keeping her knee up in this flexed position. This is something that we see people do whenever they've had a patella instability event, because this is the position that is going to be most comfortable initially because they can't straighten their knee out because that kneecap is translated on the lateral side of the joint. So patella dislocation, definitely something that I think we have to keep in mind here because of the mechanism of that forced valgus impact from the outside pushing the knee inward, and the fact that she had her knee in this flexed position immediately is what you're going to see in somebody who had a patellar instability event. If we compare that to our biodigital anatomy tool here, we're looking straight on at a right knee. That external impact is going to be coming in from the outside, and so that's going to hit the outside of the knee and it's going to push it inward. That's going to be that valgus load. That valgus load, as the knee buckles inward, is going to potentially cause tension or stress on that MCL ligament that sits right here on the inside portion of the joint. The patella, sitting right here in this little groove of the femur called the trochlea, can displace out lateral to the side. That's going to be a patellar dislocation because, again, as that knee gets pushed inwards, the patella can sometimes pop out as it wants to get pulled lateral. Again, I don't think ACL is going to be too high on my list, but definitely a possibility with this type of mechanism. It just didn't seem like the exact right combination of forces compared to what we will typically see for a contact ACL injury. Now, the second part of this is this question of what's going on with like player safety. Was this intentional? Is the WNBA not doing a good enough job of protecting their players? I think it was Cunningham's sister put out a tweet on X about protect our players, like this was an intentional thing that the official should have prevented. I will be honest, watching this video replay, there's nothing to me that screams intentional here. To me, this is a player who's coming in for a drive. They stop. As we often see with players driving into the lane, the momentum carries them forward. She doesn't turn her body to then fall more into Cunningham. She continues straight in her trajectory that she's going into the lane here. And I think this truly is just an unfortunate thing that's going to happen whenever you're playing high-level sports. Again, she drives in, there's contact, the feet get a little bit tangled up. You can't expect her to be completely upright here. It's going to be natural for somebody driving in to allow their momentum to kind of carry them down to the ground in a controlled way. She doesn't lean more into Cunningham. It's not like she dives at Cunningham's knees. I truly think this is just an unfortunate thing that is going to happen throughout the course of playing high-level sports. So again, in summer here, the things that I'm going to be thinking about. Remember, we've got this forced valgus load from the outside of the knee. Yes, something like an ACL tear would be the worst case scenario and could have happened with this mechanism, but I think more likely we're dealing with potentially an injury to the MCL ligament on the inside of the knee, maybe a patella dislocation. And also remember, right, you've got a fibula. Fibula bone is sitting there on the outside of the knee. You could have enough trauma to that fibula bone to cause a fracture in the outer part of the joint. So definitely a lot of other things to keep in mind on the differential and consider here. But with the limited replay that we have, that would be the mechanism and the things that I would keep in mind. That's it for the video, everybody. Let me know, as always, down below if you have any questions or comments, especially if you want to see more WNBA videos whenever they occur. And until next time, we'll see you later.